All right, you're still watching Kakaki, the African Voice, this Wednesday morning. After Kakaki Social, we jump in straight into our second conversation. We told you earlier that being the fourth Wednesday of the month, it is time for another round of Kakaki Cancer Awareness, which we bring to you in collaboration with the Cormode Cancer Foundation. The CEO, Dr. Denise Ejoh, is standing by. She's, of course, joining us virtually, and she'll be taking over this segment to speak to her guests. Clayton Yates is a professor of pathology. She's joining Dr. Denise Ejoh this morning. So good morning, Dr. Denise. How are you today?
Morning, Kunle. Good evening, bro. I'm good. How are you guys?
We are good.
Your background looks very bright. Both of you look very bright this morning.
Thank you.
Ours look very dull. It's the light that is helping us.
Yeah, it is well.
Thank
you so much. So let's leave you to it then.
Alrighty, thank you. Good morning, viewers. Welcome to another edition of Cormode Cancer Foundation Awareness with Denise Ejoh in partnership with AIT. Together we fight, together we win. So today we are having a very important conversation, one that affects fathers, brothers, husbands and sons across Nigeria and the African diaspora. As you know, I keep bringing discussions about prostate cancer. So what is it, prostate cancer? It's one of the most common cancers affecting men, but for men of African ancestry, it is often more aggressive, more deadly, and too often diagnosed too late. So why is this happening? And what can we do about it? Let's talk about it. So across Nigeria and many parts of Africa, men are still not taking care or talking about their health, especially when it comes to issues like prostate cancer. So today I have a very good friend of mine with me, Dr. Clayton. But before I introduce him, many present late. Many never get screened. And sadly, many lives are lost that could have been saved. But this is not just a Nigeria problem. I keep saying not everything is a Nigeria problem. There are global issues affecting men of African ancestry everywhere. Today, we are joined with someone who has spent years studying this issue, working across Africa, the US, and the African diaspora to understand why these disparities occur. And somebody who actually set up the Abeokuta Medical Center. Is it the cancer center you set up? Clayton, good morning. So my guest today is Dr. Clayton Yates.
Good morning. How are you doing?
I did a good job, didn't I?
Yes, you did. Thank you. Good to be here.
Thank you. And it's the Abeokuta Medical Center, or is it the Abeokuta Cancer Center? Which was it?
It was the medical center at the time, and we didn't set it up. We just provided them with the first, abilities to start collecting samples and doing research, so we could start to figure out, really dive into why their patients were presenting in the clinic with aggressive disease.
Yeah. So you helped set up the Abeokuta Medical Center. It's correct. I said it right. Come on.
That's a little bit far-fetched, but
you helped to set it up. Doesn't mean you set it up. It means you helped to set it up. That's good. Thank you. So together we fight, together we get. Let me just tell you all who Dr. Clayton is. He is a professor at Johns Hopkins University and a global leader in cancer disparities research. For over 15 years, he has worked extensively in Nigeria, building collaborations that explore the biological, genetic, and social factors driving aggressive cancers in represented populations. His work focuses on improving equity in cancer care and research, advancing precision oncology for diverse communities. You are very welcome to Let's Talk About It, Cancer. So now, everyone, sit back. Let's have a fantastic conversation. Together we fight, together we will win this battle. So you've worked in Nigeria for years in different capacities. I think you will tell us about some of your favorite foods along this. In your opinion, why are men of Nigerian ancestry more likely to develop aggressive prostate cancer and experience poorer outcomes compared with other populations?
No, well, first of all, that's a really great question, and I think it's multiple things. So the first factor is it appears that we, as black men, not just in Nigeria, because you kind of mentioned in your opening, is that this is a global problem. What we see across the world, where black men live and reside, they present with aggressive disease, right? So is it Nigeria, in the U.S., even if we start to look in the UK or other areas where black men use, we know black men have 60% more likelihood to be diagnosed with prostate cancer. 60% and are twice as likely to die. So these things are really, really important. But the second part of your question was why. So we think there's several reasons. One, screening, all
Mm-hmm.
right, being tested. We know if men get screened, if they get tested, if we catch or diagnose the disease early, we have much better outcomes. Okay.
Mm-hmm.
If we don't take care of ourselves, we don't go to the doctor, we don't get tested, it stays in there, it gets worse. And then when you go to the doctor, there's very few options that we have available, and you're fighting an uphill battle. So that's one major issue, is that we have to take care of our health as being. We have to be important. We have to know that we're important. We're important to our families, and we
Mm-hmm.
are a vital structure of the home. So we have to take care of ourselves. I think the second part is what I also study is that we do see some genes and genetic sort of predispositions. We see particularly some genes that seem to be driving that. So if you can imagine, if there is some genetic component in the genes of the DNA, and then you wait too late to go to the doctor, what would happen? Not good things.
Interesting, because when I started with a statement saying many present late, many never get screened, and sadly we lose many of them. That's the wrong way around then. It should have been many never get screened, many present late, then many die. Based on your explanation, because that's what you just said. Interesting. Okay, guys, are you listening? Because I'm not a doctor, you know that, so I can't help you. Let's go to the next question. Thank you. And that leads me to this one now. To what extent do genetics versus environmental issues and lifestyle factors contribute to these disparities among among young men of African descent? But we're still focusing on Nigeria. But yeah, African descent. I'm still maintaining Africa.
I think again, over my 15, now 20 years, 15 years studying prostate cancer in Nigeria, I've been studying prostate cancer for over 20 years over my career. It's all of them. It's not one or the other, right? If you could think about a situation where there may be some genetic predisposition, right? But then we have environmental factors where that exacerbate that, or we have a poor diet where we're not eating and exercising right, and so those genes that are in our body get turned on. But if we do certain things and then we live, in our lifestyle, we eat properly, we take care of ourselves, we monitor our health, those genes that could be sort of promoting the cancer kind of stay low. They don't get turned on, and then it's something we don't ever have to deal with. And so again, that's why understanding your health. I am a man, a male, obviously, but I also have a family. I have a daughter, right? And I can really tell you how the women in my life take care of themselves better than the men in my life take care of themselves. Okay, and even as a doctor who studies this, we always have to be vigilant about our own individual health because we tend to put ourselves last.
Yes.
Men, we have to put ourselves first, and we have to take care of our health, monitor our health, and make it a priority in our lives.
Yeah. But men choose life. Is it not maybe the way they choose lifestyle? Because men like having their active social lives, right? Where women are happy to stay at home and take care of themselves. Now that's not a woman's fault. Men have to do that. Men have to look at men smoking, drinking, all those things are serious factors already, which are form environmental and lifestyle options. So why can't men just do the right thing? I'm trying to push it back onto men because at the end of the day, I go back to the statement that a woman would have breast cancer and accept to have her breast cut off so she could live. A man would have prostate cancer and would not agree to just do the right thing to survive. That is an issue. So go on. Why? What do you want to? I know you're a man, so you need to help
Well,
me out.
Dr. D, if I knew the answer to that question, if I knew the answer to that question, we'd be much further along, even for myself. Again, as men, it's the image that we have for ourselves. It's the place that we see ourselves and the value that we feel we bring. And what I've been trying to tell men is that while we bring value as the head of the household, we bring value as the leader. We also bring value by being present, right?
Yes.
And being present and passing that wisdom and that knowledge that you've gained, not only to your wife, but to your children. So we have to start thinking about not only your wife, but your children that you need to pass this knowledge on to. And you can't do that if you're not around. So, it's sort of our ideals of how we feel ourselves and where our place is in the family, what our purpose is, right? And so there becomes a times that you are more than just the head of the house. You are a person that is continuing the legacy of your family. And if we start to view it in that way, I think we will take care of ourselves. The second thing is, men, again, as the providers or the home, we tend to put off our health. We tend to put that off, a little bit more. Even for me, I'll tell you right now, my wife makes sure I go to the doctor. And again, I'm a doctor, but and I have to do that. But she stays on top of me even more. She reminds me, hey, you need to be in the doctor. Have you gotten your checkup? Have you done? So, those things I think are really important. And I think we also had to say God made two people for a reason. So we need to support each other.
I agree with you.
We need to support each other, but I'm here to tell men that it's important for you to get your health is important. It's important for you to get screened.
Okay, so one, how do late diagnosis and limited access to screening and treatment services impact survival rates?
Yeah, as
And I'm
we
talking
as
about diaspora as well, because if you look at it in the UK, you can't justify why diagnosis should be late when we all have the same access to treatment, and that applies in the US. So not just like if you look at Nigeria, we could say, well, the economy, but across the diaspora as well.
No, so I think that's another major factor. So the data says if you screen early, if we detect prostate cancer in early stage, there's not a difference in outcome difference between black and white men.
So in which case
If we
now,
catch it early, if we diagnose it late, there becomes a huge outcome difference.
okay, so basically give me the top three things men need to do now to stop being late diagnosis, because the issue is late diagnosis now. So basically, prostate cancer is not a prostate diagnosis that is an issue. It's a late prostate cancer that is an issue.
Number one issue. That's number one issue. There are multiple issues, but the number one issue, if anyone can take home today, is get screened, late diagnosis. Early diagnosis saves lives.
Okay. So because of what, okay, so let's look at it. Okay. Bearing in mind, we have a lot of cultural beliefs, which you have experienced and you know because you've lived in Nigeria, stigma, misconceptions with men. I would say that those would be, in my view, the fundamental reason why men would screen late. But in your experience, considering you have lived in, for instance, Nigeria, and you have worked in very many other African countries, and you have had a lot of communication with that, what is your opinion on this cultural beliefs, stigma, misconception, and this prostate cancer issue?
I think it's a priority, prioritizing our health. It's just not a priority until you get much older. And that's what we're saying. And then it becomes too late. So men is typically, we don't prioritize our health. We prioritize other things, as you mentioned, said active lifestyle. Those other activities that you mentioned earlier are a
Yeah,
priority.
but cultural beliefs. We have people we have a lot of stigma that comes with prostrate, which may be why which
Well, it's also,
I'm trying to
a
be very
fear of
careful
loss.
that uneducated, well, illiterates will also have an opportunity to hear what they're being translated. And
Well, the prostate happens to be close to one of the vital organs of the man. Is how we self-identify ourselves, which is dealing with our testosterone, right? It provides some of the testosterone is right there and deals with sexual function. So some of the fear is loss of erectile dysfunction, or ED, that's associated with prostate cancer. Again, those sort of stigmas come with late disease. The new advances that we have today is that, again, get diagnosed early. You can resume a very healthy and active lifestyle
yes, now that's
after
the
you
point.
deal
I
with this
wanted you to
disease.
say that. You can.
You can disease. The problem is, if we get there too late, then we have problems, and then we would have to, and then we see sexual function, erectile dysfunction sort of come into a play and playing a role, much more of a role than if we diagnose it early.
Okay. Okay. I'm not going to harass anymore. What practical community-based strategies can the government, health systems, advocacy groups implement to help reduce this disparities? And I'm looking at it, as you know, I work here in Nigeria, here in the UK, and in Nigeria, and although their systems are different, community-based strategies and government and health service systems are still central to making a difference.
No, I think for one thing is setting guidelines. Okay, so setting a clear set. So these are things the government can do, setting a very clear set of guidelines. Should men get screened? When should they get screened? Right, and what age? And have it very, very clear to their primary care providers and the larger community, and have people come on shows just like yours and make sure the word and the message is very clear, so that we have a very, very distinct, clear message that we're giving, and sort of demystify some of the confusion that is out there. I think that's really important for government, that they can play a role. The second part of this is capturing the incidents, right? So a lot of, particularly in Nigeria, we're not capturing all the incidents. Things sort of happen in some of the local clinics that are basically not reporting back to the government. So what we've seen over my 15 years, that a lot of these, particularly cancers that are being diagnosed, are not getting to the government because they're not being reported, right? Because of lack of reporting and communication. So the requirement to report cases, particularly in the villages, right, that back to the government, helps the government be able to allocate resources to where it needs to go. So I think those are really big factors that where the government can play a role. And then the second thing is we again, screening. I cannot overemphasize
Yeah.
screening,
Mhm.
being screening based on clear guidelines outlined by the government. Screening is what we know saves lives.
Thank you. And my last ask, ask, uh, when next, where, what project, let me put it properly. How do people get involved in research in in Nigeria to get this data out? Because it is data we're talking about. Without data, we're not going to get this, i.e. the Sambai, using the Sambai, for instance, project.
Mhm.
You have one. Yeah, we have a prostate in Nigeria. Yes. So the prostate cancer Sambai project, how do we get people to engage in it? What would you say very briefly? What do they need to do to get involved?
No,
And how do they
absolutely.
get
So,
involved?
so one thing is connect with you through. We have sort of, I think, two major issues that I'm involved with in Nigeria. One, I co-direct a prostate cancer transatlantic consortium. It was established by Falakio Dedna. Many people may know that. We've been in Nigeria. We just celebrated 20 years of prostate cancer research in Nigeria this last September. And so over that time, we have many sites, many research projects from behavioral to genomics and all sorts of activities. So again, when you go into your doctor, you can ask about research studies dealing with prostate cancer. The second initiative, as you mentioned before, is called SEMBI, where our goal is to recruit 15,000 Black men to start to understand the question you asked me in the beginning. Is it our environment? Is it social? Is it cultural beliefs? Is it genetics? How do they all relate to each other? And so SEMBI is an international. Nigeria is just one. We will have sites across the African diaspora, from Ghana as well as Kenya, Ethiopia. We have Black men in the UK as well as Black men in the US. And so we're going to compare all of these factors, how people believe, the culture, the society, the environment, and the genetics. And so again, we're looking, as we begin to launch, which we feel like we will launch earlier in mid this year. Please look out for the SEMBI moniker and enroll in our study. And we would hope that you can contribute to saving the life of yourself as well as your neighbor.
Thank you very much. Thank you. Thank you, Dr. Clayton. Thank you. Okay, so I'm going to send you an email after this, and you're going to send me the sites where they can go to so that we can put it out. Okay. Thank you. Thank you, Dr. Yates, for sharing your knowledge and for the work you continue to do across the continent. Today's conversation reminds us of one simple truth. Prostate cancer does not have to be a death sentence. Early detection saves lives, awareness changes outcomes, and conversations like this can break the silence. So together we fight, together we win. It's very nice to have you, and sorry I had to wake you up this early in the morning. To every man watching today, please do not wait. Know your risks. Speak to your doctor and get yourself tested. And to families, encourage the men in your lives. Sometimes that one conversation can save their life. As I sign off, I am Dr. Denise Ejoh, the CEO of Cormode Cancer Foundation. Follow us on all our social media platforms, Instagram, Facebook, YouTube. And this video will be on our YouTube page as soon as we can get it up, so you can actually go back and listen to the conversation and get involved. Thank you, Dr. Yates, for joining me this morning, and I think I'm going to say good night to you, right? Because you're going back to bed.
Yes, good night.
Thank you very much.
Thank you for having me.
Thank you.
My pleasure.
All right, Kakaaki Cancer Awareness coming to you from our collaborator there, Dr. Denise Ejoh, the CEO of Cormode Cancer Foundation.
All right, yes, that was quite an interesting conversation. I see that the disparity in treatment and even in detection across African men right there, it was really rich and worthwhile. All right, from there we go to entertainment and lifestyle on Kakaaki the African.